Hello everyone, now let us discuss about 2023 ICD 10cm coding guidelines for chapter 21 part 7. And as we have discussed earlier, chapter 21 mainly deals with Z codes that are nothing but factors influencing the health status and contact with health services. And in the current session, we will be discussing about the Z codes that are pertinent to status. And here is the list of Z codes that we are going to discuss now. The first one is Z88, which is nothing but allergy status to drugs, medicaments, and biological substances. Except Z88.9, allergy status to unspecified drugs, medicaments, and biological substances. The next is Z89, that is status for acquired absence of limb. The next is Z90, acquired absence of organs not elsewhere classified. The next is Z91.0. This is further classified. Allergy status other than to drugs and biological substances. And finally Z92.82. This is the final code, which is nothing but status post administration of TPA, tissue plasminogen activating factor, TPA, in a different facility within the last 24 hours prior to the admission to current facility. Assign the code Z92.82, status post administration of TPA in a different facility within the last 24 hours prior to admission to current facility as the secondary diagnosis when a patient is received by transfer into facility and documentation indicates that they were administered tissue plasminogen activator within the last 24 hours. That is, in simple terms, patient has been admitted to one hospital and he has been transferred from one hospital to another hospital. And in the previous or former hospital, the patient might have been administered TPA within the last 24 hours. So whenever the patient is administered TPA within the last 24 hours prior to admission to another facility or to current facility, then you need to code Z92.82. And this guidelines applies even if the patient is still receiving the TPA at the time they were received into the current facility. Appropriate code for the condition to which TPA was administered, such as cerebrovascular accident, cerebrovascular disease, or myocardial infarction, should be assigned as PDX or first. And code Z92.82 is only applicable to the receiving facility record and not to the transferring facility record. This is important. Code Z92.82 is only applicable to the receiving facility record and not to the transferring facility record. Now coming to first category, that is Z88, which is nothing but allergy status to drugs, medicaments, and biological substances. The first code is Z88.0, allergy status to penicillin. Next is Z88.1. It deals with allergy status to other antibiotic agent. The next is Z88.2. Allergy status to sulfonamides. The next is Z88.3. It deals with allergy status to other infective agents. Z88.4 is indicated for allergy status to anesthetic agent. And Z88.5 is indicated for allergy status to narcotic agent. Then Z88.6 is indicated for allergy status to analgesic, that is pain reducing analgesic agent. The next is Z88.7. It deals with allergy status to serum and vaccine. The next is Z88.8. Allergy status to other drugs, medicaments, and biological substances. And finally Z88.9. Allergy status to unspecified drugs, medicaments, and biological substances. Now let us see an example. Patient is a 65-year-old male admitted to the hospital with abdominal pain and he has a history of Crohn's disease of the large intestine. He also has a history of coronary artery disease and had a heart attack 5 years ago. But he has no problem since then. He smoked cigarettes for 45 years and quit before his myocardial infarction. He also has a history of allergic reaction to penicillins and cephalosporins. Currently, the reason for admission is abdominal pain and patient has a history of Crohn's disease. So PDX would be K50.114, Crohn's disease of large intestine with abscess. Next, I25.2, old myocardial infarction, followed by Z87.891, personal history of nicotine dependence or personal history of tobacco use. And then Z88.0 to indicate allergy status to penicillin because patient has a history of allergic reactions to penicillin and cephalosporins. And then Z88.1, that is nothing but allergy status to other antibiotic agent, that is nothing but cephalosporin. The next category is Z89. So Z89 deals with acquired absence of limb. First code is Z89.011. It indicates acquired absence of right thumb. The next is Z89.012. It indicates acquired absence of left thumb. And finally Z89.019. It deals with acquired absence of unspecified thumb. The next is Z89.021. Here, fifth digit 1 indicates thumb and fifth digit 2 indicates ring finger. And sixth digit 1 indicates right, 2 indicates left, and 9 indicates unspecified. Sixth digit is common for majority of the anatomical sites. 1 indicates right, 2 indicates left, and 9 indicates unspecified. So Z89.021 indicates acquired absence of right ring finger. The next is Z89.022 indicates acquired absence of left finger. And Z89.029 indicates acquired absence of unspecified finger. The next is Z89.111. It deals with acquired absence of right hand. Next is Z89.112. It deals with acquired absence of left hand. The next is Z89.119. It deals with acquired absence of unspecified hand. The next code is Z89.121. It deals with acquired absence of right wrist. 122 indicates left wrist. 129 indicates acquired absence of unspecified wrist. And 201 indicates acquired absence of right upper limb unspecified level. The next is Z89.202 indicates acquired absence of left upper limb unspecified level. The next is Z89.209 indicates acquired absence of unspecified upper limb unspecified level, acquired absence of arm NOS. For acquired absence of arm NOS, whenever the level is not mentioned, laterality is not mentioned, the NOS code is Z89.209 for acquired absence of arm. The next is Z89.211, acquired absence of right upper limb below elbow. Here, level is mentioned. The next is Z89.212 indicates acquired absence of left upper limb below elbow. The next is Z89.219 indicates acquired absence of unspecified upper limb below elbow. The next code is Z89.221, acquired absence of right upper limb above elbow. The next is Z89.222, acquired absence of left upper limb above elbow. And 229 indicates acquired absence of unspecified upper limb above elbow. Next is Z89.231 indicates acquired absence of right shoulder. 232 indicates acquired absence of left shoulder and 239 indicates acquired absence of unspecified shoulder. And similarly Z89.411 indicates acquired absence of right great toe, 412 indicates left great toe and 419 indicates unspecified great toe. And 421, Z89.421 indicates acquired absence of other right toe other than great toe. Any toe other than great toe you need to code Z89.421. The next is Z89.422, acquired absence of other left toe. And finally 429 indicates acquired absence of other toe unspecified side. The next is Z89.431 indicates acquired absence of right foot. 432 indicates acquired absence of left foot and 439 indicates acquired absence of unspecified foot. The next is Z89.441, acquired absence of right ankle. 442 indicates acquired absence of left ankle, and 449 indicates acquired absence of unspecified ankle. The next code is Z89.511, acquired absence of right leg below knee. Right leg below knee amputation. You can see below knee amputation codes. So Z89.511 is given for acquired absence of right leg below knee. Next, Z89.512 indicates acquired absence of left leg below knee. And 519 indicates unspecified leg below knee. And for acquired absence of right knee, the code is Z89.521. And acquired absence of left knee, the code is Z89.522. And acquired absence of unspecified knee, it is 529. The next is Z89.611, acquired absence of right leg above knee. The next is Z89.612 indicates acquired absence of left leg above knee. And finally, Z89.619 indicates acquired absence of unspecified leg above knee. The next code is Z89.621. It indicates acquired absence of right hip joint. The next is Z89.622. It indicates acquired absence of left hip joint. Next, Z89.629 indicates acquired absence of unspecified hip joint. And finally, Z89.9 indicates acquired absence of limb unspecified. Now, let us see an example. Patient presents with left knee pain and the past surgical history indicates total above knee amputation, right side. So, patient had a total above knee amputation and currently patient is presenting with left knee pain. So, first PDX would be M25.6562 indicates pain in left knee, followed by Z89.611 to indicate acquired absence of right leg above knee, because total above knee amputation has been performed on right side. Then you need to indicate the status code Z89.611, acquired absence of right leg above knee. Now the next category is Z90 category. It deals with acquired absence of organs not elsewhere classified. The first code is Z90.01. It indicates acquired absence of eye. The next is Z90.02. It indicates acquired absence of larynx. Then Z90.09 indicates acquired absence of other part of head and neck. Z90.10 indicates acquired absence of unspecified breast and nipple. The next is Z90.11 indicates acquired absence of right breast and nipple. The next is Z90.12 indicates acquired absence of left breast and nipple. Z90.13 indicates acquired absence of bilateral breast and nipple. The next Z90.2 indicates acquired absence of lung or part of lung. The next is Z90.3 indicates acquired absence of stomach or part of stomach. The next code is Z90.410. It indicates acquired total absence of pancreas or acquired absence of pancreas. The next is Z90.411. It indicates acquired partial absence of pancreas. The next is Z90.49. Indicates acquired absence of other specified parts of digestive tract. The next is Z90.5. Indicates acquired absence of kidney. 90.6 indicates acquired absence of other parts of urinary tract. And Z90.710 indicates acquired absence of both cervix and uterus, or acquired absence of uterus NOS, or status post total hysterectomy. In all these cases, you need to code Z90.710. And Z90.711 indicates acquired absence of uterus with remaining cervical stump. Status post partial hysterectomy with remaining cervical stump. Next is Z90.712 to indicate acquired absence of cervix with remaining uterus. Next code is Z90.721, acquired total absence of ovaries, unilateral. The next is Z90.722, acquired partial absence of ovaries, bilateral. And Z90.79 indicates acquired absence of other genital organ. And Z90.81 indicates acquired absence of spleen, and Z90.89 indicates acquired absence of other organs. Now let us see an example. A 45-year-old patient presents with abdominal pain. A 45-year-old female patient presents with abdominal pain, and past surgical history indicates total hysterectomy. So first, the reason for visit is abdominal pain. So R10.9 is coded to indicate abdominal pain unspecified, followed by Z90.710, acquired absence of both cervix and uterus. Now the next category is Z91. Z91.01 series. It indicates allergy status other than to drugs and biological substances. So first code is Z91.010 indicates allergy to peanuts. Z91.011 indicates allergy to milk products. Z91.012 indicates allergy to eggs. And Z91.013 indicates allergy to seafood, shellfish, octopus or squid ink. Next is Z91.014 indicates allergy to mammalian meats or allergy to beef, lamb, pork, red meat, etc. The next is Z91.018 allergy to other seafoods and allergy to nuts other than peanuts. The next is Z91.02. It indicates food additive allergy status. And Z91.030 indicates bee allergy status. And Z91.038 indicates other insect allergy status. And Z91.040 indicates latex allergy status or latex sensitivity status. The next is Z91.041 indicates radiographic dye allergy status or allergy status to contrast media used for diagnostic X-ray procedure. The next is Z91.048. It indicates other non-medicinal substance allergy status. And finally, Z91.09 indicates other allergy status other than to drugs and drugs of biological substances. Drugs and drug biological substances. Now let us see a final example. A 45-year-old patient presents with hypertension. Medications are reviewed. And if you see the allergy status, it is indicated that the patient is allergic to seafood and peanuts. So first, patient is presenting with hypertension and medications are reviewed. So first code is I10 to indicate essential hypertension, followed by Z91.010 to indicate allergy to peanuts status, and then Z91.013 to indicate allergy to seafood. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.